Hello, I'm Sue Augustus. This is an overview of the Medicare program. The information applies to people with disabilities, including older Americans with physical, cognitive, sensory, or mental impairments. I just turned 65 and I think I am eligible for Medicare. How do I find out? Medicare is the federal health insurance program that is paid for through your Social Security taxes. To be eligible for Medicare, you have to be 65 and older and have paid into Social Security, or you have been found disabled by Social Security and have been eligible to receive Social Security disability insurance benefits for at least 24 months, or you have end-stage renal disease, which is permanent kidney failure requiring dialysis or a kidney transplant. Some disabled adult children and some spouses are also eligible. The Social Security Administration can tell you if you are eligible. Are there income or asset requirements for Medicare? There is no income or asset test, although depending on your income, you may have to pay more for your Part B premium. Do I have to be a U.S. citizen to receive Medicare? You have to be a U.S. citizen or be here legally in the U.S. to be eligible to receive Medicare if the other requirements are met. Medicare has three parts. Part A pays for hospital care, skilled nursing facility care, nursing home care, as long as the care you need is skilled nursing care and not custodial care, hospice, some home health services. Part B pays for most of your doctors and outpatient services, those services such as ambulance services, doctor visits, durable medical equipment, mental health, inpatient, outpatient, and partial hospitalization, getting a second opinion before surgery, and some limited outpatient prescription drugs. Part D Medicare pays for prescriptions. You have to buy Part D separately from regular Medicare. Is there a Medicare Part C? A Medicare Advantage plan is also called Medicare Part C. A Medicare Advantage plan is a type of Medicare health plan offered by a private company that contracts with Medicare to provide you with all your Part A and Part B benefits. Medicare Advantage plans include health maintenance organizations, preferred provider organizations, private fee-for-service plans, special needs plans, and Medicare medical savings account plans. If you are enrolled in a Medicare Advantage plan, Medicare services are covered through the plan and are not paid for under original Medicare. Most Medicare Advantage plans offer prescription drug coverage. Medicare pays for medically necessary services. Those are services or supplies that are needed to diagnose or treat your medical condition and that meet acceptable standards of medical practice. Medicare also pays for preventive services. Those are services to prevent illness like the flu or detect it at an early stage when treatment is most likely to work best. You pay nothing for most preventive services if you get the services from a healthcare provider who accepts assignment. Part A Medicare is usually free. In some instances, people have to pay for it. Part B premiums are $104.90 per month in 2014, although it may be higher if your yearly income is higher, and the amount changes on an annual basis. Part D plans have a wide range of prices. Medicare does not pay the entire cost of the services. Medicare pays 80%, and you are responsible for the remaining 20%. You can buy supplemental policies to cover the 20%, and doctors and other providers can also accept assignment, meaning that they will accept whatever Medicare pays and will not bill you for the remainder. If you cannot afford your Medicare premiums, states will pay some of the Part B premium cost for low-income individuals. The Medicare cost-sharing programs cover the cost of Medicare Part B premiums, coinsurance, and deductibles for qualified Medicare beneficiaries with incomes up to 100% of the federal poverty level. For those with incomes between 100% up to 135%, the specified low-income beneficiary program covers only the cost of the Part B premium. Resources are limited to $7,080 for individuals and $10,620 for a couple. More information is available on the State of Illinois website. What did the Affordable Care Act do for Medicare? The Affordable Care Act included new preventive services for Medicare beneficiaries. The preventive screenings are free. In addition, you can receive a free annual wellness visit. You will not have to pay anything for these services, no copays or deductibles. The Affordable Care Act will phase out the Part D donut hole. This will help people pay significantly less for prescriptions by 2020. There will also be more programs for people who have low incomes who qualify for the Extra Help Premium program. People with higher annual incomes will pay higher Part D premiums. The annual enrollment period for those on Medicare Advantage plans and Part D plans will be from October 15, 2014 to December 7, 2014, with the plan starting January 1. Also, to disenroll from Medicare Advantage plans, Part C plans, the period will run from January to February 14, 2015, to return to original Medicare and buy a Part D plan. Visit mymedicare.gov for more information. Enrollment is automatic for many people through the Social Security Administration for Parts A and B as soon as they turn 65 or are on Social Security disability insurance benefits. If you are not sure, you can apply online at Social Security, visit your local Social Security office, call Social Security's 800 number at 800-772-1213. TTY users should call 800-325-0778. If you worked for a railroad, you can call the Railroad Retirement Board at 877-772-5772 or visit medicare.gov. You can also call the Medicare 800 number at 800-633-4227. For more information and for more assistance, you can call a senior health insurance program counselor at 1-800-548-9034 or visit ageoptions.org for a wealth of information on Medicare. And finally, you can contact your local area agency on aging. You can check their website or call their helpline at 1-800-252-8966.